site care. I don't think we need to do that. I think we already talked about it, doing the IV insertion. We already did the IV, BCIV, so you're good there. Okay. All right, so we can get started with this one. So IV fluid. So first thing, you're just gonna look at compare your, this is gonna be on your checklist, but I'm just comparing the order versus the MAR. I have my normal saline, 1,000 cc bag, and it's gonna be going in at 150 cc per hour. And I measure with my MAR. My patient's had a rectal bleeding. This patient's gonna go into endoscopy, so it makes sense to give IV fluid to keep them, fluid volume. So I have good reason, the correct reason to give the IV fluid. And it looks like after the procedure, the patient's gonna come back, we're gonna convert it into 75 cc per hour. So that's gonna be, you can change the rate because you already have an order there. So we're good here. And we're just gonna go down to our checklist. Okay, so we have IV bag, and from what I can see, it looks good. It does not expire. And then you have here, there's a barcode that you can scan when you're at the hospital. After you scan the patient's arm band, name, date of birth, verify the allergy, they're not allergic to anything. You can actually scan through this plastic shield. Okay, it should work. And then it's not expired. I don't see anything floating in here from what I can see. So I have this. And then I have my primary tubing right here. And then I have my drop factor as 15. Okay, so it's gonna be important when you have to count how many drops per minute. And since we're talking about drops, we have 150 cc per hour, 15 drops per mil, and then how many drops per minute? And you have one of you.
You said 50 milliliters per hour? What
Yeah,
was it?
so we can do the calculation there, and then we'll just keep going here. Expiration date is, expiration date, it was here earlier. Is it? Yeah, I think it's kind of buried in there somewhere. It was on here. We're gonna say it's not expired, otherwise we'll be searching forever. I think this one is easier to see. This one, let's see. Oh, tubing looks a little different. We got it?
Oh no, I wasn't sure like what
You
was
said
I
150 cc's per mil
60.
150 cc per hour,
per hour.
and then 15 drops per milli.
Okay.
So,
So we just
Oh.
add the 15
yeah,
drops per mil.
perfect. Okay, so we're gonna say it's not expired, so I have my tubing, and then I have my IV label here.
So 60 times 15.
Now you doing double checking on the math calculation.
Does
Does not
not
seem right.
Is drops the same thing as CC?
No,
No.
milliliters,
No.
same CC.
CC is the same as
as
mil. Yeah.
Okay. So
I have my normal saline flush. I have tape somewhere.
okay, so
I have
then
my alcohol.
it would be
pad.
150 times 15 divided by 60. I had it reversed.
Okay, and then I had clean gloves. Normally I wouldn't wear gloves when I'm just checking all
37.5.
this, and just because of COVID, we have to cover everything up. Otherwise, you don't need gloves for this part. You only need it when you're ready to touch the IV site. And then pen I have in the pocket, paper to do
CC's the same.
calculations.
So you have mill up here, mill up here.
Oh my gosh, I'm sorry.
That's why when you need to like do calculation like this, have
Yeah,
someone do
hold
it
on, let me
with
think
you.
about
It's just
that.
like,
So
I
we have
did this, I did this, I did this.
Milliliters
Is it
per
look
hour,
right? Yeah.
1 hour is 16
Okay.
minutes.
And then
Oh,
I
is
always,
it 15 drops per mil?
mhm.
Yes.
So 150 divided by 60 times 15.
Mhm.
Because that's our mils, that cancels out, and then we have the drops up here, right? That's what we want, so then that'll be 1. That's what I had before, that's still the
Yeah.
37.5.
Yeah, yeah.
Is that what it is?
Mhm.
Oh, okay.
Yeah, you got it. So it's about 38 drops per minute. So you divide it by 2, you'll have like 19 drops per 30 seconds. So about 10 drops-ish, yeah, per 15 seconds. So that's kind of how you can do it, because when you're doing it by gravity, you're only estimating, because it's not controlled that well when the patient raises their arm up. it's gonna go slower. If they drop their arm down, it's gonna go faster. If you move the bag a certain way, it's gonna, change the rate. And like when you're doing it with the pump, it's pretty much controlled. But if you do it by gravity, you're only estimating. I remember when I was a nurse starting, we'll have like family members sitting, that's in Taiwan, I don't think that's gonna fly here. The family members sitting right this side, I don't know if that's what happened in where you came from, or I don't know. It's sitting the best side with from the family members. Like, watch the IV fluid. If it's almost empty, come get me. And they'll be like sitting there, family members sitting there, looking at the drop. And then when it's like IV piggyback, same thing. Look at little tiny chamber. When that's almost empty, okay? When it gets this line, come get me. That's how we often remember. They'll be like
It's a
sitting
big
there watching the
responsibility.
IV. But they're so helpful. And then when we need someone to feed the patient, there's always somebody there to feed the patient. We don't have to feed the patient. But anyway, back in old days, it doesn't happen here. Now we don't even allow family member to visit their patients. We have to be their family too. Okay, we'll keep going here. We're going to check our medication, MR against our orders. Everything looks good. Purpose is good. Wash hands. We already did that. You know how to introduce yourself. Explain the procedure to the patient. You know how to explain it. We're just going to attach the IV fluid so they can go to their procedure to give them fluid, replenish their fluid because they're bleeding out, so you're going to give them fluid so they don't drop their blood pressure. And IV side, it's good. You can flush your IV right now. You can do it either way. If you want to check the IV, make sure they're patent, you can do it right now. Or you can wait until you're ready to attach the IV tubing to the IV side. So we're gonna just do it then. You can visually inspect. Looks good. I don't see any signs of infiltration or phlebitis. The tubing looks good. Okay, so I already got my equipment here. And then we have the correct IV fluid. And then at this point, we can go ahead and log into the computer to Meditech, scan the patient's armband, scan the bag, submit, safely comply. I remember all that from this week. Yeah, okay, so that's good. And then check and verbalize solution against physician's order. So we're gonna grab the bag, look to make sure that I have the correct one. I have 0.9 normal saline, and I'm gonna give it 150 cc per hour. I have an active order, and everything's good. And look at the MAR, it has not been administered, so I'm good here. Okay, and then I check the expiration date again. Looks good. Okay. And going on to the next step. So at this point, I can go ahead and open the bag because I already checked outside. Everything looks good. I don't see anything punctured. And then you see that they already cut it two sides here. So one here, one here. When you open the IV bag, don't be afraid. You're not going to break anything. Just go ahead and tear open with one momentum. Some students are very gentle, which is a good thing. You want to be gentle, and then when you're too gentle with this bag, you're gonna not be able to open the bag correctly. Okay, so to open it, you just kind of hold it, and then you're just gonna do like this, one motion. If you didn't do it quite right, you want it to be gentle. You're gonna open it slowly, very slowly, and eventually it's just not gonna go anymore. So if that happens, what should you do about it? Like, if let's say that I didn't open this. That's when you need a pair of scissors.
I was thinking that was the wrong answer.
That's what a scissor is for, okay? But if you do it right the first time, I mean, it's okay if you didn't quite do it right because you don't know how much force to go for it. Eventually, you'll get to a point where you know how much force to go for it to open your IV bag. And now you're gonna pick it up, kind of look at it, look inside, make sure there's nothing is floating, everything looks good. I'm gonna squeeze the bag, make sure nothing's leaking. Sometimes you'll see like a little condensation outside because we're in Texas, it's humid. They've been sitting in the truck for a while. You'll see a little condensation, that's fine. And then you can just squeeze it, kind of turn it upside down like it is. And if you don't see any water leaking out, then it probably is okay. If there's any hole in it, if you squeeze on it, it's gonna need more water, and you know this bag is no good. You can just trash it. I basically just cut a hole in it and then drain the water out and then get a new bag. But if you see anything floating in it, I've seen it one time. It's just something weird floating in it. I have no idea what it is. It's like, that is not supposed to be in it. It's supposed to be a clear, like watercolor fluid, nothing in it. And so what should you do in that situation?
Get a new one.
Get a new one? Yes. What else? Yes. Good
Well,
job. If you don't know
okay.
the answer, tell the charge nurse. Yes, you tell the charge nurse, and you probably need to report this to, you know, the whoever sent you the IV fluid, so charge nurse and maybe the supply officer, so that they can notify whoever gave us this fluid. the
Would
company.
you break it and then drain it in the sink?
Yeah, I
Or
mean,
would
you
you
can
keep
still,
it?
but I was, in that case, I wouldn't open it because you wanna keep it as kind of like evidence, like this is what I see. And so that way they can see, oh, what are you talking about? If you already drain it, then you can't see it. But if you just have a little leaking, nothing is floating in it, it's just somebody poke a hole in it on accident or the bag was just faulty, then you can just get rid of it. You don't need to report to anybody if it's just leaking. But I'm saying like if there's anything floating in it, it's like there may be a whole batch of it that's not good, that's contaminated. You don't want to give it to people, right? Yeah, so that's why you need to like report it to maybe like risk manager. Somebody need to know about it. Yeah. So.
If it's leaking and you have to like waste it for the bag away, do you have to document that anywhere like for inventory or you just throw it away?
I just charge it the floor supply. Since I already charged this to the patient, if I grab the other bag, I'm just gonna hit floor supply for like inventory purpose. That way it's not charged to the patient. I don't know how they do charge, but that way I'm not charging the patient twice.
Okay.
Because that's not patient's fault that we have a leaky bag. Good question. All right, so that's done. All right, let's see, what do I do next? Check, hit and see. Oh, wait, did I get it? Oh, okay, I went too far. I'm still here. I was like, wait, that's not right. Okay, I will check the leaks, expiration date, and any cloudiness or particles, anything like that in there. I would calculate the drip rate, so we're good. Now we are going to remove tubing from the package. Okay, so it says tear here. It gives you instruction, but most students will forget about it and they will try to like open it here, open it here, open it here. Oh, no, it didn't open. So you just kind of like read the package. It usually tells you like how to easily open it, and you can just usually just open it like so. And then I keep my inside of the bag, you know, clean as possible. And this tip and, oh, they lose the paper thing. I'm supposed to keep the tubing together. Aw, because they're supposed to have a paper wrapping. I guess this one doesn't have it. Maybe they changed how they put this together. But they're supposed to have some kind of wrapping around this tubing to keep it together so it doesn't get tangled up. Since they don't have it, I'm just gonna have to use my hand. And because I don't want this tip to hit the floor or the trash can, so. And then the first thing you do with the IV tubing is to close this roller clamp, okay? That way nothing is flowing anywhere when you're trying to spike the bag, okay? Make sure I look at the right list. So where am I going? Okay. Now we're gonna securely hold the two tips and then we're gonna spike the bag. This is a plastic bag, so this, even though we say spike the bag, there's not that much of spiking motion. I think the other IV fluid bag might have more of a spiking motion, but this one, see this neck part is really skinny. So when you spike through it, make sure you have this lined up straight. If you don't do that, you're gonna spike through it and there will be a leaking point here. And that point, you just have to change the IV bag and the tubing because everything is contaminated. You don't want to give patient, you know, contaminated fluid. So you just basically waste the bag of fluid, your time, and the tubing. So just make sure that you be very, very careful. You can do it while you're holding it here. So basically you take this off, take this cap off, and just put it in and kind of squeeze it in that way. Or if you have not spiked this bag yet, you can do it like over at the IV pole, like so. So you can put it up here, okay? And then you can take this off, nice and easy, and then it's not leaking. But know that when you come to open lab and practice, this has been spiked before. So don't put it this way, otherwise it's gonna leak everywhere. And then the TA will be like, what did you do? And take this off. Once you take the cover off, this part is sterile. So don't touch it. If you touch it, what do you need to do?
The new one.
New one. There's no cleaning involved, okay? Just get a new tubing, yeah. And same thing with the tip, this tip of the tubing. If you touch the tip without the cap, just get a new tubing, okay? So now you're ready to spike. So this is where you put your tubing in, the spike in there. This part, you see the little kind of like latex or whatever rubber part? That's where your pharmacist can add medication. We used to do a lot of medication, adding medication. I used to be the RT, the pharmacist, the nurse, everybody. So I was the one adding medication to the bag. I'll be adding potassium, vitamin C, all kinds of things in the bag. We don't do that here in Austin. I mean, you have the pharmacists, they're the one doing it. Yeah, they have special training, a better, cleaner environment. I used to do it at the nurse's station. We mix chemo at the nurse's station, you know, that's telling you how old I am. So now you're just gonna carefully, you can use your two-hand technique. You have a little shaky hand like me, and then you just kind of squeeze it in. Just keep training, and then make sure you don't spike through the neck part. And there's a little invisible line here. You'll see it when you're actually doing it yourself. You want to push it all the way up there, so that way it's nice and steady. And it's got, I don't know how to explain it, but once you're in there good, it's hard to like take it apart. Unless you yank it really hard, it will come apart, but if you just lightly tug on it, it shouldn't come out. So that's how they designed it. So now you have it in there. You're gonna put this tip of this tubing into the bag. And that's how I do it. I hold it in here. So when the fluid is dripping, it's not gonna drip everywhere onto the floor. If you use a trash can, you have to hold a tubing. Otherwise, if the tip touch the trash can, then you contaminate the tubing. Now you're just gonna open the royal clamp like lightly. So, oh wait, I forgot one step. I keep talking, I forgot. I have to tell you this story so that way you feel comfortable. When I was a nursing student, when I was in your shoes, this was the hardest skill for me. I could not apply the tubing correctly to save my life. I keep forgetting something. I think this part was the one I forget the most. Squeeze the chamber. So, see, I almost forgot when I was talking to you. So, oh, wait, no, not quite yet. Once you squeeze the chamber, now you're gonna open it. So now you feel better. Like, I was struggling with this. And I just took it home. That's fact. I don't know if they can allow you to take the tubing home to practice. I don't know if that's allowed or not. They change the rules all the time, but I asked my instructor. She said that's fine. I took the bag home. I took the tubing home with me. I practiced and practiced and practiced. I created my own open bag until I got it. I got this. I was so excited. All right, now you're gonna open this, and it should come down. There it goes. And see that fluid coming down? Which is like color coded.
Do you open it all the way or just a little bit?
I do it like, in the middle, so that way it doesn't come too fast. When you have the fluid come down so fast, it creates turbulence, and sometimes that create air bubble. And once you pass through the first part of it, you can open it up some more and see it's coming. I don't know if you can see it.
Yeah, there it is.
There you go, you see it. We need to make it color coded so we can see the fluid better. You see it, and now it's coming, and then just let it drip into the bag. I think there's kind of tubing that doesn't actually drip into it, but eventually it will stop flowing. I think that the tubing at St. David's, it'll keep going, and now it stopped, and you can go ahead and close. So to close the roll clamp, you just basically make it tighter, so now it's closed. So you know it's closed because you're trying to take it, move it, it doesn't move, okay? But I'm gonna go ahead and close this part. And then when I say open, when this is open, you can actually move it. Make sense? So that's open. And when I say close your roller clamp, this is closed. So when it's closed, then it doesn't move. Good? All right. And then when I'm not quite ready to do anything with this yet, you can go ahead and loop it up here so it doesn't hit anything dirty. Anything up here we consider clean. Anything below the pump, I see that as dirty. So we want it up here. Now you're gonna prime your saline flush, get my alcohol ready, make sure I didn't miss any steps.
Was that number 8 whenever you were opening the clamp a little bit and letting the fluid come out?
Yes,
Okay.
that's number 8. It says moderate flow of solution through the tubing. Yes, number 8. And then, label tubing with date time initial. So you use this it tells you what to write. So you just do daytime initial when it starts, when it discarded. And it says RN initials, you can put your initial. You're allowed to change tubing, so I don't know. They should put student nurse RN. So that's that. Okay. And then done queen glove, close drawer clamp on old tubing. Number 11, if you have an old tubing attached to the setting lock, you can go ahead and disconnect it. Let's say your tubing is old and it could be changed, then that's when you disconnect the old tubing, okay? And then discard old tubing, scrub the hub, and then we are going to flush the IV, okay? So we're gonna scrub the hub, so make sure you hover over it for 15 seconds, and then say simulated 15 seconds, wait for it to dry, and then I already primed this normal saline, so it's good. Take the cap off, like this. Make sure I don't have any, I have an air bubble kind of right there, so I can carefully push up. There we go, that's good. I can do your little two-hand technique. Open this, check blood return. I see blood return. Now I'm gonna flush. Wait, I think the blood is not open. It's so Dell, you didn't open your blood for me. Okay. Hope it's in the right place. I did not start this IV. I need to find more clamps. Let's see. Where are you not going? Open.
That one's the wrong one.
That should be fine. Means we have to like restart an IV. Yeah. I don't have enough time for that. We gotta keep going with the skills. Alright, we're gonna have to get to a new IV site, huh? I was able to check blood return though. That's interesting.
Okay.
Oh, yeah, it's going, but why is it not flushing? Oh, okay, I see. The catheter is not all the way straight. I'm gonna have to keep it. It's in the right place. Okay. All right, we saved you. I have to talk to you again. Okay. Now you're gonna go ahead and take this down. See, I leave my saline flush on there so I don't have to re-clean it. And now I'm gonna take this cap off. And see this part moves, okay? So you wanna make sure you push it all the way up so it stays steady. Hold it like so, okay? And then you can now go ahead and take your saline flush off. Okay, and then you wanna do your kind of two-hand technique to put it on there. I go at the angle so that way it's less likely I'll miss it. If you go, I'm gonna show you something wrong with this. So if you go straight and then you try to put it on there, you didn't quite have the right angle, you're gonna touch it like that. So that's why, you know, it's better if you go at the angle like so and put your two hands together. When you have 100% control over it, you have a 99% success rate. You do it that way. So now it's attached, good to go. And now I can go ahead and open my roller clamp. And now its IV is dripping. So we say about 10 drops per 15 seconds, right? So that's the rate roughly. So, and then you can look at it, look at the clock, and then just keep counting until you get it right, okay? So that's how you do it. And then you're gonna send the patient to endoscopy procedure, okay? And then, you know, probably after a while, you're gonna go and come back, and you can use something like this to like tape it onto the IV bag to kind of help you measure if you have to do it by gravity. And then about an hour later, I should come back in. If the patient's still here waiting for procedure, I need to have about 150 cc infused, so somewhere around here. If I have this much infused, like, oh, I totally did the math wrong. You know, you did it really too fast, then you just slow it down. But if an hour later you come back in, you only have this much in, that means you do it a little too slow, or the IV might be kinked. You just have to put an arm bore or figure out a way to make the IV, infuse the correct way. Alright? And then I'm gonna show you something. Do we have another bag of fluid? Like a used one? Yeah. Okay, just gonna look good. I'm just gonna show them like how to switch the IV bag. Do we have one? Oh, yeah, I'll use this one. Okay, so you're good. I'm gonna show you a different kind of IV bag. So, just gonna give me a new one. So, with this kind of bag, this is where they're gonna add the medication that need to be added, like vitamin. I call it banana bag, like yellow vitamin bag. That's where they can add it. But this kind of bag, this is where you're gonna take it off. So you just pour it off. Let's say I need to change to a different fluid. I can go ahead and just close this, okay? And now, remember, this has been spiked before. So you don't want to just take it down like so. You want it to go ahead and flip it upside down, like so, okay? Before you take this out, this will be harder to do. Not like it's right or wrong, but it's just easier. Take this off. And then you're gonna have to use a little bit of twisting motion. Ooh, sorry. And now you're just gonna spike it, okay? And just gonna squeeze it back and forth into it. So, okay. I think there's a little cap. There we go. This will work. Okay, I think that should work. I'm gonna let it sit here. So that's it. And now you put it in here, like so, okay? It's easy, right? Just remember, like, what before you do something with it, turn it upside down, and that way it can go. And let's say I get too excited of squeezing the chamber. You see, now I can't see anything. What am I gonna do with this? How do I fix it?
Can you drain
Yeah,
Is
some?
there
right.
somewhere else you can just connect it to drain some?
You can, or the easiest way would be to take this bag, turn it upside down, and I usually like kink it off up here so it doesn't create air bubble, and then just squeeze some of it back into the bag. And you're done. Let's see if I can actually create some kind of air bubble. Trying to create air bubble. See if I can get it. I don't know.
There you go. You got one.
I got one. Oh, now my gloves are stuck. Okay. Somehow I get it too excited and I create this big old air bubble here. You can disconnect it there and do it, kind of drain it out that way. Or another way to fix it is to basically, you can use a pen or something to kind of, I loop it around my finger and then I squeeze it up there. Remember, air goes out of this one. Probably has the it's got the anti-reflex valve here, so it probably won't work. So another way to fix it is you get a 10 cc syringe, and then you can get it from here. Clean it off, and then you just get a 10 cc syringe, attach it right here, up here, and then you can go ahead and close everything like down below, so nothing is gonna come. And you already have this drip chamber already squeezed, right? So at this point, you can just pull back. You see the air is coming with me? And then the air is gonna come. And you see a little bit more there. See how that fits? You can do it this way. And if you have the tiny one, just a little tiny one here, you could flick it like this. That's probably what you see a lot, like on TV or nurses doing that. A little tiny one like that, and just kind of loop it around like this, and it goes up. But that's another way to do it. But if it's like really kind of below here, you're gonna have to see. If it's like really close to the saline lock, you don't have enough, room up here to fix it. You just have to like close the roller clamp And then you might have to like just disconnect it from here and get rid of it that way. If it's already past this point, there's no way you can take it out of there. You don't want air to get into the patient's system. Let's see if there's anything else.
Where do you label the tubing, like,
Oh,
where
good
do you
question.
put it at?
After you put a daytime initial discard bay, this is where I usually put it because that way people can see it.
Mhm.
Like it's right up here. I can walk into the room and see, oh yeah, the methugen is good, it's not expired, and we know it's labeled. Yeah, so that's where you put it. Trying to see, and then documentation, you just put date, when you administer the IV fluid. Over here it says documentation, and since I didn't discard any old fluid, I don't have to document that. Your location of IV looks good. Change the tubing's changed and label how the patient tolerated, if you give any education to the patient. So that's documentation. Let me see if there's anything else. Take IV. So yeah, I will probably take the IV to the tubing to the arm so it doesn't come apart easily. That to the lower position, do some teaching. And then you want to come back and verify everything is working well. Okay. Now I'm going to see if there's anything else that I was going to show you that I haven't showed you yet. Change the bag, tubing. Oh, I think I show everything. Any questions? Okay. Oh, and then when you're ready to, let's say patient went to endoscopy and bag, and you're ready to change the flow rate to the lower. Not good. I think it's the tubing probably after I retake it. And then you can lower the rate of infusion to 75 cc per hour, which is like half of what it had been. So it will be like 5 drops per 15 seconds or something like that. So you just kind of do your calculation that way. If you're not sure if your calculation is correct or not, ask your other nurses and can you verify my math and make sure it's right. Okay, good. And I think today's skill seems to be easier for the morning group. So you might have time to practice